Hello, my name is Cynthia and I'll be conducting the newborn assessment. I am a student nurse. I'm going to be performing hand hygiene. Now I'm going to be coming, and the first thing that I'm going to do, if the baby is asleep, if the newborn is asleep, I'm going to assess the newborn. I'm going to measure him or her. I'm going to measure this infant from the top of the head, and I'm going to straighten out the foot, measure it back down there. I'm also going to be checking the circumference of the head. Okay, and for that we use our tape measure. So we would measure the circumference of the head. Try not to wake the baby. Okay, that's our first thing. We also want to get their weight as well as those three. Okay, I'm also checking to make sure that the newborn is taken care of. I'm going to check how the baby looks. I want to see the color. I want to make sure that this newborn doesn't look jaundice. I don't see any jaundice. Because this newborn is a little darker skin, I am going to be checking on the hands, the palms, the eyes. I want to make sure to see if the baby is able to be consoled. If we're going to be putting the finger or anything in the mouth, we need to wear gloves. So we want to make sure of the rashes. We want to make sure all over the back, the front. We want to lift the diaper a little bit, not too bad. As I'm doing this, I'm also going to take a look at the umbilical cord. I will not touch it. Okay, and just make sure that we tell the parents to take care of how to care for the umbilical cord. Okay. Okay, I want to make sure, I did check to make sure that the umbilical cord was not infected. We want to tell the parents not to put anything on it. Don't give them a bath until it falls off. Okay, and also don't force it to fall off, because that can cause trauma to the area. Okay, so next we're going to check. We're going to put gloves on, and we're going to check the palate. So we're going to check the cleft lip, cleft palate, and we're going to check to see the roof of the mouth. We're going to make sure to see if it's intact. Okay, and then we want to make sure that when they suck, that there's no cleft. We want to make sure that there's no that there's a suck, swallow, and breathe coordination. Do they have a strong suck? Do they have a weak suck? Is it coordinated, or are they choking? And I see this newborn is good. Okay, so next I'm going to take off the... Okay, so now we're going to take a look at the ears. Well, to see if they're bent. If they are bent, we see that this one's a little bit bent. This other one is straight. So what it symbolizes is preterm. So next we're going to check the eyes. We're going to check the head. We're going to lift the baby a little bit and support the head. Make sure that the rest of the body is anterior fontanelle. We're just going to not push too much, so we want it to be flat. If it's depressed, it could mean dehydration. I see that this one is not depressed. And then we also have one here in the back. The one in the back is a lot smaller. This one will be closing up within a few weeks, and this one is going to take a little longer. Okay, at least about 9 to 18 months. Okay. Okay, so now as I have them here, I'm going to be checking to see if it's symmetrical, that it's aligned. We have our two eyes. It is typical for one eye to kind of go off for the time being. That will go away. Right now it's just they're trying to fixate their eyes. Okay. Okay, and the round shape should come back. Okay. Next, we're gonna look inside the mouth, and we're gonna check for any Epstein. As for the tongue, we're gonna make sure we're gonna bring the bottom lip out, and we're gonna see if the tongue can stick out at least to the bottom of their lip, because this way it's going to be easier for lactation. So now we're going to do the red light reflex, and what we want to do, we want to make sure that the lights are dim, and we're going to check the eyes. We want to make sure that the eye is not yellow, and we want to be you want to use it just right here. You hold it a little bit. So now we're going to do the red light reflex, and what we want to do, we want to make sure that the lights are dim, and we're going to check the eyes. We want to make sure that the eye is not yellow, and we want to be you want to use it just right here. You hold it a little bit at an angle, and that's it. So we want to see the red circle on both sides, and that's a red reflex. Okay, so next we're going to take a look at the neck. Is it short? Is it thick? Is the head held at the midline? It is. Is the trachea in the midline? It is as well. Does the newborn have good range of motion, ability to flex and extend? And we see that they do. We're going to check for the torticollis, which is the head incline from one side to another. Okay, and we see that the newborn does as well. We're also going to be checking for the chest now, and for the chest we're going to be checking, making sure that there are no murmurs, making sure we're going to listen to their lungs. We're also going to be listening to the belly, the abdomen. And now we're going to turn him over, and we're going to listen to the back lungs. Okay. We're also going to listen to the abdomen. Okay. We're also going to feel. We want it to be nice and soft. We're going to check the umbilical cord as well. Okay, so this is a boy. We're going to check that both testes are distended. We're going to verify that the meatus is at the tip of the penis. This baby is not circumcised, so we're going to perfuse the foreskin that covers the gland penis. And then we're going to keep track of the first voiding, which would occur at within the first 24 hours. I saw that there was a record that this newborn did urinate already. It already did void in labor and delivery. We're going to move on to check the spine. We're going to turn the baby around gently. I'm going to put him on my back. We're going to make sure that the spine is straight, that posture is flexed. We're going to support the head at all times. Anytime that we're moving, we want to make sure that we support the head. We want to make sure the chin flexes on upper chest. They're well coordinated, the sporadic movements. We want to make sure the degree of hypotonicity or hypertonicity, because it may indicate central nervous system damage. Okay, now for the extremities, we already kind of looked at them. Are they able to flex? Yes. the range of motion, yes. At this point, we're going to check the lower extremities. We're going to look to make sure that they have 10 fingers, 5 fingers in each hand, 5 fingers, 5 toes in each foot and each leg. We want to make sure that the fists are clenched. We want to check how their strength is. Are they holding on to us? Yes, no. Is it a good grip? The legs, if I push up, do they extend back? If I hold them down straight, do they bring them back up? Yes. If I'm touching the skin here, does the newborn come towards me? Yes. How about this side? Yes. So what we're also going to do with the legs, the extremities, we're going to conduct some tests to see if they have hip dysplasia, and we're going to conduct the Barlow test. So we're going to applying a little pressure downward and then to the middle. So you'd hear a pop. Okay, for the Ortolani, you start with the middle, bend legs together. So you pull towards you and to the side. Okay, it would create a pop. Okay, so if it was positive, you would send the infant to ultrasound to see if they have any hip dysplasia. The way to fix it, if need be, we could put an extra diaper on top. Okay, so we're gonna check the tone. Okay, and if you can pull his limbs out and bring them back. At this point, while we have the diaper off, we would also check the anus to make sure that there is an opening. Okay, it's good. I'm going to cover the newborn back up. I'm going to check the coloration of the extremities, the toes, the fingers. Sometimes it does turn blue because they are the extremities, and it takes a little longer to warm because they're so if they're cold, or if they're crying a lot, they could turn a little blue, but they'll be fine. Just make sure that they're toasty and warm.